Hello guys, sorry. How are you? How is your day going? And today we are going to talk about the miscellaneous. Actually, I have tomorrow pharmacology practical and also a quiz. So I will be doing the quiz topics. Actually, I have some topics which are related to the quiz. So let's start. So. So the first question says, what is the rate of drug movement or extent of distribution? So so to answer this question, VD volume of distribution is developed. Okay. So apparent distribution. So the apparent volume of distribution VD is an important pharmacokinetic parameter that relates the amount of drug in the body to the concentration in the plasma. Okay, so VD is equal to amount of drug in the body divided by the drug concentration in the body. That is VD is equal to D by C. So amount of drug in the body by the concentration in the blood. Okay, in the blood. So VD is equal to the amount of drug in the body by drug concentration in the blood. Okay, blood and body blood. Okay, so the calculated parameter for VD has no direct physical equivalent, therefore it is usually denoted by the apparent VD. Apparent. VD is theoretical, not a real physiological volume. However, it serves as an indicator of the rate of movement and extent of drug distribution in the body. Normally, standard values of volume of fluid compartment in the average 70 kg adult are as follows: plasma 5 liters, extracellular fluid is 14 liters, and total body water is 42 liters. If a drug tends to stay within the systemic circulation central compartment or bloodstream, it will appear to have VD equal to that of the volume of the bloodstream, 5 liters or less. Example heparin. Okay. However, if a drug has an affinity for a distinct compartment, meaning that the drug travels out of the bloodstream and into the tissues, organs, and other sites beyond central circulation. Example psychotropic drugs VD will be much more larger than the physiological volume of the blood body fluids anatomically. Sorry guys, I have a little fever. So, however, if a drug has an affinity for a distant compartment, meaning that the drug travels out of the bloodstream and into the tissues, organs, and other sites beyond the central circulation. Example: psychotropic drugs (VD) will be much larger than the physiological volume of the blood body fluids and anatomically possible volume of fluids. If VD for a drug 5 liter is 5 liter or less, it can be inferred that the drug stays in the systemic circulation, okay, and has a shorter half-life. Half-life is basically the amount of time taken by a drug to reduce its concentration by half. So it is very important. And if the VD is small, then the half-life is also small, okay, and spends less time in the body, okay, is eliminated more rapidly and has a shorter dosing interval, meaning it must be dosed more frequently. Okay. In contrast, if VD for a drug is larger, it is deduced that the drug does not stay within the bloodstream. Drug will be eliminated much more slowly from the body. Elimination rate, along with half-life for such a drug, will be much longer, and the dosing interval is less frequent. Okay. So what are the effects of large VD? So So if the VD is large, it means that the drug is able to pass from the bloodstream into the other compartments of the body. Okay, so it will be difficult for for the body to remove this drug from the body. Okay, so they will have longer half life, and and it will be much difficult for the drug to be removed from the body, because it is traveled from the bloodstream towards the other compartments of the body. I remember, if the volume of the drug distribution is less than 14 liters, this denotes that the drug is circulated in the liquid part, and in the case of intoxication, extracorporeal hemodialysis will be effective. Okay. If the volume of distribution is more than 42 liters, hemodialysis won't have any benefit, because the substance has already penetrated into the tissues. Okay. Okay. So then, systemic effects. Systemic effects. What are the systemic effects of the this? Okay. So there are two types of metabolic reactions of biotransformation: phase one and phase two. Phase one is first reaction, and phase two is the second reaction. Phase one drug, you know what this biotransformation of reaction is important for the drug to be removed from our body. Okay. So, phase one reaction that convert the parent drug but to a more soluble, water soluble, or more reactive product by unmasking or inserting a polar functional group, like OH, SH, and NH2. A major part of phase one reaction, especially oxidation reaction, is catalyzed by hemoproteins, the so-called cytochrome P450 CYP enzymes, also called as a mixed functional microsomal enzyme oxidases. These enzymes are found in high concentration in the smooth endoplasmic reticulum of the liver. The bulk of CYP enzymes are located in the liver and the intestinal wall, which explains why these organs are responsible for the major part of our drug metabolism. They are not highly selective in their substrates, so a relatively small number of P450 isomers are responsible for the metabolism of drug of thousands of drugs. Okay, they are not highly selective. Selective. Phase two reaction. This phase consists of a conjugation reaction that involve addition of subgroups to a drug molecule. The subgroups are added include polar moiety, glucuronate, acetate, glutathione, glycine, sulfate, and methyl groups. As a result, phase two reaction increase water solubility of the drug molecule, and therefore metabolites from the phase two metabolism can be excreted by the kidney. Like phase one enzymes, phase two enzymes okay. They are not really highly selective in nature. Okay. In phase one, what happens that there is the addition of a OH, SH, and NH2 groups. In this case, there is the addition of a glucuronate, acetate, glutathione, glycine, sulfate, and methyl groups. And as phase one enzyme, that is a Cytochrome P450, they are not selective. These are also not selective. Okay. Note glucuronidation is the most common and the most important conjugation reaction. Neonates are deficient in this conjugating system, making them particularly vulnerable to drugs like chloramphenicol, which is inactivated by the addition of glucuronic acid, resulting in gray baby syndrome. Okay. ठीक. So, sites of drug metabolism. So, the most important organ for drug metabolism or biotransformation is the liver. The kidneys play an important role in the metabolism of some drugs. A few drugs, example esters, are metabolized in the many tissues, example liver, blood, intestinal wall. Because of the broad distribution of their in all cases, the goal is to make the drug. Now, determinants of biotransmission or metabolism rate. So, the rate of biotransmission of a drug may vary markedly among the different individuals. This variation is due to genetic. Examples for genetic factors is the following: isoniazid and some other amines like like hydralazine and procanamide are metabolized in the phase 2 reaction by an acetylation. People who are deficient in acetylation capacity termed slow acetylators may have prolonged or toxic responses to normal doses of these drugs. Slow accelerators constitute about 50% of white and African American persons in US and a much smaller percentage of Asian and Inuit Eskimo population. Okay. So what are the factors that determine the biotransmission rates? First is the genetics, like some like the drugs like isoniazid and hydralazine. They are metabolized with the help of acetylation. So these drugs, they become more easy target for the kidney to excrete. Okay. But the thing is that some people, they can't produce the acetylation reaction. So they are termed slow acetylation and may have prolonged or toxic responses to the normal drug dose. Okay. And slow accelerators constitute about 50% of white and African American American Muslims in the US, and a much smaller percentage of Asian and Inuit Eskimo populations. So, with aging, the liver's capacity for metabolism through the microsomal enzymes is reduced by 30% because hepatic volume and blood flow are decreased. Thus, drugs reach higher levels and have prolonged T half or half life in the elderly. Metabolism generally is slower in newborn versus adult. Metabolism is in healthy children or teens may be faster than adults. Disease related and gender. Induced differences, hepatic blood flow in women is lower than in the men. For all ages, men have higher metabolic rates than the women due to a smaller skeletal muscle component. So, drug induced, a large number of drugs alter their own metabolism and the metabolism of the other drugs by inducing the synthesis of large amounts of metabolizing enzymes, usually P450 enzymes in the liver, or by inhibiting those enzymes. These are examples of pharmacokinetic drug interactions. The most common strong inducers of drug metabolism are carbamazepine, phenobarbital. Smoking is a common cause of enzyme reduction in the liver and lung and may increase the metabolism of some drugs, rifampin, phenytoin, ethanol. These drugs facilitate the termination of action of many drugs. Okay, so the most common causes are T. Carbazepine, smoking, rifampin, phenytoin. Carbamazepine, phenobarbital, ethanol, smoking, and rifampin and phenytoin. So inhibitors of drug metabolism are amiodarone, cimetidine, furanocoumarins present in the grapefruit juice, azole antifungals, ritonavir, theophylline, clozapine, erythromycin, ketoconazole. Okay, so these are the drugs which inhibit the drug metabolism. As a rule, inhibitors of CYP enzymes elevate plasma levels of drug that are substrates for of the CYP enzymes. As a rule, inhibitors of CYP enzymes elevate plasma levels of drugs. Okay. Oh, okay. So, what is the function of these drugs? They inhibit the metabolism. Like they don't like they they what can you say that they they, they don't let the drug be removed from our body. Okay, excreted from our body. Okay, so. So what happened that the drug which was supposed to be extracted from the body, okay, which was supposed to be which was supposed to be to be removed from our body, it doesn't go. That's why the undesirable toxic effect of the drug can be seen. And these drugs, which inhibit the metabolism of other drugs, are the amiodarone, azole antifungals, erythromycin, ritonavir, ketoconazole, and azole antifungal and furanocoumarins. Okay, we will learn only four. Amiodarone, A ARDC, okay. Amiodarone, ritonavir, theophylline, and clozapine, ARTC. And what about the drugs that favor the metabolism? Okay, so mm, ARTC, R, okay. So, rifampin, then carbamazepine, and phenobarbital, smoking. Okay, ethanol. These are the drugs which favor the drug metabolism and A stand for the amiodarone, A R ritonavir, T for theophylline, and C for the clozapine. Yeah, or else we will, erythromycin. This is important. We know this erythromycin. Okay, so amiodarone, cimetidine, ritonavir, and erythromycin. Okay, ACRE, 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 hurry, acre. Okay, so acre and ECRE, E C P T. Ethanol, we will discuss it later. T. Okay, so antidiabetic circulation. Some drugs undergo biotransformation with the formation of polar water soluble conjugates with the glucuronic acid, which are excreted, excreted in the bile and released while absorption from the intestine occurs. The substance again passing through the hepatic barrier again enters the system circulation and then returns to the liver, forming conjugates and excreted in the bile. The cycle is repeated 6 to 8 times a day, and this process is called the hepatoduodenal intrahepatic circulation. Circulation. Disturbance of the hepatoduodenal circulation of the drug in the case of dysbiosis or cirrhosis of liver can lead to decrease in concentration of a drug in the blood and a consequence to a decrease or cessation of the pharmacological action. So metabolism is not synonymous with the drug inactivation. Some drugs are converted metabolized to active toxic molecules to products by metabolism via drug metabolism, and the important examples include methyl alcohol, ethylene glycol, and at higher doses or in presence of liver disease. Okay, so drug metabolism is not synonymous with drug inhalation. Some okay. So some drugs are converted metabolite to active toxic molecules produced by metabolism via drug metabolism enzymes like this uh, rifampin. Rifampin, yeah. Is it true, guys? Is it true? I guess. Hey, one second. ला मेरे को ला मेरे को भी ला. So, drug metabolism is not synonymous with the drug inactivation. Some drugs are metabolized to active toxic molecules by metabolism via drug metabolizing enzymes. Important examples include methyl alcohol, ethylene glycol, and at higher doses or in presence of liver disease, acetaminophen. It is a toxic mechanism. Okay, so what are they trying to say in this page is that the drug metabolism is not similar to the drug excretion. Okay, so 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 some drugs are converted metabolized to active toxic molecules products by metabolism via drug metabolizing enzymes. Important examples include methyl alcohol, ethylene glycol, and at high doses or in presence of liver disease, acetaminophen. It is toxic. It is a toxic metabolism. So some drugs are metabolized by the some drugs to its active form. Okay. So that is called toxic metabolism. Okay. So a small number of drugs combine irreversibly with the receptor in the tissue, so that the disappearance from the blood. So a small number of drugs combine irreversibly with the receptors in the tissue, so that the disappearance from the bloodstream is not equivalent to the cessation of the drug action. Conversely, these drugs may have very prolonged action. For example, phenoxybenzamine, an irreversible inhibitor of adrenoceptase, is eliminated from the bloodstream in less than 1 hour after administration. The drug action, however, lasts for 40 days. Check the what is how it's Thank you. Okay. I'm having dal, guys. सही है ब्रो. अच्छा है. Okay. So, phenoxybenzamine and irreversible inhibitor of adrenoreceptors is eliminated from the bloodstream in less than 1 hour after administration. The drug action, however, for lack of treatment. Oh, okay. So, this drug just binds to the receptor in the tissues and causes the action. It's action. Okay. Hmm. Phenoxybenzamine. Remember, phenoxy. Okay. So, hmm. Drug elimination is not the same as drug excision. The drug may be eliminated or occurs by the termination of drug action or by metabolism long before the modified molecules are excreted from the body. On the other hand, for drugs that are metabolized, they are always activated. Hmm. Okay. Awesome. Awesome थोड़ा. So for drugs with active metabolites, example diazepam, elimination of the parent molecule by metabolism is not synonymous with the termination of action. Okay. क्या बोला? Okay. Okay. Once a drug enters the body, right? Elimination of drugs. So once a drug enters the body, the process of elimination begins. Drugs are eliminated by reducing the concentration or amount in the body. Drug elimination is usually separated into the two major components: excision and biotransformation. Drug excision, the removal of the intact, unchanged drugs from the body. Biotransformation, conservation of drug to a metabolite in the body. So there are three major routes of elimination: hepatic, hepatic metabolism, elimination in the bile, and elimination in the urine. Okay. Elimination via the nephrons. Okay. Hmm. So what is drug clearance? So drug clearance estimate the amount of drug is cleared from the body per unit time. Okay. Drug half-life is often used as a measure of drug clearance. Okay. Okay. Amount of drug cleared from the body per unit time. Okay. Half-life, the time required for the amount of drug to fall to 50% of the earlier measurement. TF is equal to 0.692 into VD but clearance. Okay. On the other hand, the half-life of a drug may be decreased by hepatic increased hepatic blood flow, increased metabolism, and decreased protein binding when the unbound fraction of the drug is higher and the greater amount of drug is clearance. It relates the rate of elimination of drug to the plasma or blood concentration. Clearance is equal to the rate of elimination of drug by plasma drug concentration. So rate of elimination of drug. So zero VD. What is VD? VD is the okay. Okay. As the plasma drug concentration increases during the okay. So as the increases during the okay. So as the plasma drug concentration decreases during the elimination, okay, the rate of drug elimination decreases accordingly, but the clearance remains constant. Renal clearance reflects the speed with which the blood is completely cleared of the drug as it passes through the kidney. And for a drug eliminated from with phosphorescent clearance is constant. Okay. So total clearance can be calculated by using the following equation. Ready? Okay. There is for the more the more the volume of a distribution. Okay. The more the half life at low clearance condition and more the clearance. But right. So the more the volume of a distribution. Okay. ज़्यादा वॉल्यूम ऑफ डिस्ट्रीब्यूशन तो हाफ लाइफ ज़्यादा होगी ओके एट लो क्लियरेंस लो होगा ओके एंड मोर द क्लियरेंस रेट कम हाफ लाइफ कम ए क्या चूतिया है सही छोटा ठीक ओके पता है हम्म mechanism of elimination does not affect the nor does the okay. The rate of metabolism or elimination of drugs may be zero order. That is constant regardless of proportional to the concentration. First order elimination. So if we administer 500 milligram of drug, so the time required for the so when the half-life of the drug is achieved, then the concentration of the drug will be 250 milligrams. Okay. The metabolism rate increases with the drug concentration. Okay. So at therapeutic concentration of most drugs, usually some small fraction of metabolizing enzymes sites are occupied. Okay. So first elimination when most of the enzyme sites are occupied. Okay, metabolism occurs at its maximum rate and does not change in proportional to okay. Most drugs are okay. Okay. Aspirin, when given in high doses, it can follow the zero order kinetics or non-linear kinetics. So zero order means like it doesn't follow anything. Like whatever amount of drug we give, it will metabolize only certain part of the drug. Okay. In case of zero order kinetic, a fixed amount of drug is maintained per in time. Okay. So as drug concentration increases, maintenance shift okay. Okay. For drugs eliminated by first half-life is constantly. Mhm. The content of such a drug in the blood will be decreased by 50% for every half-life. Okay, okay. First order elimination. The term first order elimination implies that the rate of the elimination. Hmm. Okay. Hmm. For drugs with first order kinetics, the rate of elimination units per hour is proportional to the concentration. This is a more common process. Drugs with first order elimination have a characteristic half-life of elimination that is constituted. The term zero implies that the rate of elimination constituted. Okay. So the elimination of drugs that occurs after admission but before it is okay. Or pre-system elimination. Okay. Elimination process depend on age, the physical and physical drug, tissue mining, the okay. Disease at age 80, clearance is typically reduced to half of what it was at age 30, and other variables usually alter the clearance of a drug. With age, the proportion of adipose tissue in the human body gradually increases, the metabolic rate of medicinal substances decreases, and on the other hand, the intensity of the glomerular filtration accordingly. In the elderly patient, the process of removing medicine substances from the body slows down, and therefore, in order to avoid toxic effect, it is rational to reduce the dose of the drug by an average 30%. Okay. Cardinal physiological changes in the body of a pregnant woman also significantly affect the pharmacokinetics of the drug. Under the influence of a progesterone, peroxidase is suppressed. Okay, and the process of a drug adjustment is delayed. Okay, with the intervention and the okay. Since vasodilation increases blood. Okay, okay. So in case of pregnancy, we should not give the pregnant woman drug orally because it will be it will be metabolized by the first pass effect, and the therapeutic value of the drug will be lost. So we should give the female with the intramuscular administration of drug. The pharmacological effects that develops rapidly since vasodilation increases blood circulation in muscle tissue. Interestingly, in pregnant women, especially in the third trimester of pregnancy, the blood will increase by 1/3 with deletion. Okay, there is always a decreasing. Okay, we say the free fraction of medication increase and toxicity. Body gains weight from water and diabetes. The distribution of drugs is according to how treating. Hmm. Dosage regimen. Dosage regimen is a plan for drug administration over a period of time. An optimal dosage regimen results in the achievement of therapeutic levels of drug in the blood without exceeding the minimum toxic concentration. So, goal or aim of optimal dosage regimen is the achievement of a maximum benefit with a minimum adverse effects. Successful drug therapy in many illnesses is accomplished only if the drug concentration is maintained at a steady high level. This requirement necessitates regular drug intake and the dosage schedule that ensures that the plasma concentration neither falls below the 7. Okay. Ideally, we should try to maintain ideally we should try to maintain the steady state concentration of drug in the treatment process. Okay. So a steady state, the condition in which the average total amount of drug in the body does not change over multiple dosing cycles. That is the condition in which the rate of drug elimination equals the rate of admission. Thus, a steady state is achieved in which the plasma concentration. Okay, that is the steady state concentration is universally perpendicular. Okay, so clearance ज़्यादा होगी तो steady state कम होगा. Hmm. Okay. When a drug is administered at a regular intervals over prolonged periods, the rise of hmm. Depending upon okay. To maintain the plasma concentration within a specified range over long periods of therapy, a schedule of maintenance doses is used. Dosing rate is equal to the clearance into desired plasma concentration by bioavailability. If it is necessary to achieve the target plasma level rapidly, a loading dose is used to load the VD with the drug. The loading dose is equal to the VD into desired plasma concentration by bioavailability. A loading dose is most useful for drugs that are issued from the body. Okay. Ideally, the dosing plan is based on the knowledge of both the minimum therapeutic and the minimum toxic concentration of the drug as well as its clearance, VD, and half life. The number of doses to be given per day is usually determined by half-life of a drug and the difference between the minimum and therapeutic intoxication. Hmm. The more the half-life, the less frequently the remedies should be given, and vice versa. Hmm. So, so if the differences between the therapeutic and toxic concentration is small, then small and more frequent doses may be. Therapeutic window is the safe range between the minimum therapeutic concentration and the minimum toxic concentration. For drugs with low concentration, with low therapeutic indices, plasma concentration are measured in low. Okay, guys. So I will be back after I will eat uh, the dinner. Okay. So bye.